All right, let's talk about one of the most important things you'll ever do in nursing, pharmacology safety. We're going to build your fortress of medication safety. You know that feeling, right? That split second of hesitation before you give a drug? Well, these are the non-negotiable rules that are going to give you the confidence to act safely every single time. So let's jump right into a situation you are absolutely going to face. Your patient's blood pressure is low, 90/50, and the med that's due right now is a blood pressure med. It's designed to lower it even more. Your heart kind of pounds a little, right? What do? Stick with me, and by the end of this, the answer is going to feel like second nature. So where do we even begin? Well, it all boils down to one simple, foundational idea. This is the golden rule that everything else is built on. And here it is. Seriously, if you remember nothing else, remember this. If it feels unsafe, you hold, period. If there is any doubt in your mind, your default action is to stop and hold that medication. Your number one job is to protect your patient. Safety always beats giving the drug. Always. Okay, so that's the rule. But how do you know if something's unsafe? We need a system, right? A checklist. It's kind of like a pilot's pre-flight check before takeoff. You just don't skip it. Ever.
All right, here's the algorithm you're going to use every single time. Let's walk through it together. First up, A. That's for allergies, of course. Then R for your rights of medication administration. Got those down? Good. Next, V for vitals and L for labs. Then you have to ask yourself two big S questions. Is my patient stable? And is this drug safe to give right now? Only after you've checked all those boxes do you get to the final step. G for give, or H for hold.
Okay, let's zoom in on that L for labs, because this is huge. These aren't just numbers on a screen, they're screaming at you. Look at potassium. If it's outside that 3 to 6 range, we're talking about the heart. That's a potential deadly arrhythmia. You stop any med that messes with K+. See an INR over 4.5? Whoa, that's a massive bleed risk. You hold that warfarin. And creatinine over 1.3? That's your kidney yelling for help. You've got to stop those kidney toxic meds, like right now. So that checklist, that's your go-to for every single drug. But now we got to talk about the real heavy hitters, the ones that are extra dangerous. Think of them as the enemies you absolutely have to know on site. And hey, we've got a great way to remember them. It's IOADKC. That's insulin, opioids, anticoagulants, digoxin, K for potassium, and C for cardiac drugs. If you've got one of these in your hand, your spidey senses should be tingling. These are the meds that you always want to double check with another nurse. For real. So what makes them so scary? It's what they can do. We're talking about drugs that can literally shut down an airway, stop someone from breathing, stop the heart, cause a catastrophic bleed, wreck an organ, or send someone's blood sugar into a nosedive. These are the big 6 priorities you've always got to be watching out for. You know how some meds say may cause dizziness? Yeah, this isn't that. What we're about to cover is the stop the drug now and call for help list. These are the red alert, 5-alarm fire side effects you need to recognize in a heartbeat. First things first, let's talk airway and breathing, your ABCs. You see a patient on an April drug and their face or lips start to swell? That's angioedema. You stop that drug. Just remember, prills puff the face. Patient gets an antibiotic and suddenly they're itchy and can't breathe? That's anaphylaxis. And listen, for opioids or benzos, this rule is law. If their respiratory rate is under 12, you hold the med. End of story. And the danger isn't just about breathing. You've got a patient on an SSRI and they're suddenly shivering, have a high temp, and seem agitated. That could be serotonin syndrome. Just remember SHIVER. What about a patient on an antipsychotic who's suddenly super hot, stiff as a board, with a sky-high blood pressure? You've got to think NMS, neuroleptic malignant syndrome. Spotting these patterns is what saves lives. All right, so you've got all this knowledge locked in. Now for the fun part, putting it to work. Let's talk about how to crush those who do you see first priority questions you see on every single test. So imagine this. 4 call lights are going off at once. 4 people need their meds. You can't be everywhere. So who do you go to first? Who is your number one, can't wait another second priority? Okay, here are the rules that will literally tell you the answer. Number 1, and this is a big one, a new med is always the highest risk. Why? Because of allergies. Number 2, IV drugs beat oral drugs because they work right now. 3, be super cautious with drugs that have a narrow therapeutic range. There's just no room for error. And finally, if you've got a patient with organ failure or someone on a blood thinner who might be bleeding, they jump right to the top of the list. Let's make this real. You have patient A getting their very first dose of lisinopril. Then you have patient B who's been on it for a week. Who are you worried about? Who do you need to watch like a hawk? It's patient A every single time. That first dose is where a bad reaction is most likely to pop up. Just remember, new is your new nursing priority. Okay, deep breath, let's pull all of this together. We're going to do a super fast, rapid-fire review of the absolute must-knows. This is going to be your ultimate pharm safety cheat sheet. First up, opioids and benzos. If their respiratory rate is under 12, you give no more med. Simple as that. Next, got a patient with bad kidneys or a bad liver? Just remember this rhyme. If the organ's weak, the drug will peak. Their body can't get rid of it, so it builds up to toxic levels way faster. This one is a straight-up emergency. Your patient is on a blood thinner and they fall, especially if they hit their head. That's a code-level event. You have to assume they have a brain bleed until it's proven otherwise. And finally, when you're not sure what to do, remember the word stop. That's your action plan. S for swelling, T for trouble breathing, O for out-of-range vitals, and P for new pain, especially in the chest or head. You see any of those? You stop the med and you get help. Immediately. All right, get your phone out. Seriously, pause this and take a screenshot because this slide is pure gold. It's everything we've talked about boiled down to the basics. If unsafe, hold. Vitals and labs give you permission. If it messes with breathing, stop. And those super risky drugs, IOADKC. This is it. This is your safety foundation. So there you have it. You've just built this amazing fortress of medication safety. Every rule is a brick. So the next time you're about to give a med, I want you to think, which one of these bricks, which one of these rules are you going to use first to keep your patient safe?